They wait until they experience their own. So they have the risk, the high risk. That's human being, I think. They're more difficult to handle. I'm Tuti Parwati Merati. I work since the first of AIDS cases at Sanglah Hospital in Denpasar. Sanglah Hospital is a teaching hospital and a top referral hospital for Bali. For people seeking an HIV antibody test, they could come to our VCT clinic now, and we start the VCT clinic since 2004. We have a free test for antibody HIV testing. We will give pre-test counseling, and then the test itself, and then post-test counseling. Also antiretroviral treatment and anti-tuberculosis treatment and all other treatment for opportunistic infection. So we call it one-stop service at VCT clinic. All the services is done at the same places. Yeah, people enjoy to come to this clinic because the service, the human services to this clinic is comfortable to them. People feel safe to talk about their risk. They trust the doctor to treat them at this clinic. We are happy because we have a counselor, a nurse, an NGO who work and support the VCT clinic at Sanglah Hospital.
When did you start working for HIV and your journey since then?
I start to work in HIV/AIDS since the first case been detected in the ward of Sanglah Hospital. Yeah, it was 1987. We know at that time that Bali is already exposed to HIV, and we don't know much about HIV. At that moment also we didn't have ARV. So the government of Indonesia sent me with other two colleagues from Jakarta and Surabaya to have a site visit to study in Australia in Sydney Hospital. Yeah, at that time I saw many patient in Sydney Hospital. From that study, we come back to Indonesia and then start to give information, education to high-risk group, the medical student and tourism student. We start to conduct a research on knowledge, attitude, and behavior of a certain group. Consists of the gay group, the female sex worker, the gigolo or male sex worker, and also student of the tourism sector. Yeah. At that moment, we don't have many patients, only one or two patients, so we still have time to do the intervention. We make a brochure and material of education in Indonesia, so we make it not just translated from the English version, but we do our own research. By the time, then we have more and more cases. Yeah, and then I start to learn about the clinical manifestation of the disease. I can see many more patients similar to the one that I have saw in Sydney Hospital. We have the VCT available in our clinic in Sanglah, and then we do the test voluntarily. And then I also studied about the molecular epidemiology of HIV in Indonesia. So we study about the subtype of HIV among my patients. I found that subtype AE is the most frequent subtype. And then we work now with clinical response to antiretroviral treatment. So now we treat the patient with ARV, with heart, and we can see that the people's getting better and they can back to their normal life, productive life with taking antiretroviral. But after I finished with knowledge, attitude, and behavior research, I developed NGO to work on this field. So we give the information, education to people in Kuta and Lovina, in Ubud, yeah, and also in Denpasar, to increase their awareness of HIV and to let them know how to prevent the disease. Yeah. Up to now, Yayasan Citra Usada Indonesia, which is the NGO, still do that in Bali, yeah, and more and more now people been contacted by the NGO. Not only Citra Usada in Bali, we have another NGO who also active in information education in HIV and AIDS. We know that the expert, even in the US and the Europe, it's difficult to develop vaccine to them. So this indicate that the virus is so smart, they can enter the body and hide in the body and live in the body without a chance to the body. Once it attached to the host cell, we cannot make them apart again. It just integrate in the host cell and then you cannot separate them. They use our body system to replicate the virus. So, and the virus is living in the cells. It can circulate and can arrive and achieve any organ in the body. So that's why we can have many kind of clinical manifestation. The main target is the CD4 lymphocyte, which is a central role of the immune system in the body. Yeah, by infecting and destroying this CD4 cell, the virus actually destroy the immune system of the human. The number and the function of the lymphocyte CD4 will destroy, and we call it immune deficiency, and it's a good opportunity to any other microbes, microorganism to infect the person.
Dr. Tuti, can you tell us that is the virus that prevailing in Asia, is it different from the virus in other countries like Western countries?
Yeah, HIV virus in Indonesia is mostly similar to the one in Thai, which is also AE. But we have also the subtype B, which is very, very common in the US and in the Europe, and also in Australia. But we have one indicate also subtype C, which is very common in India, and the other is subtype G, which is common in Latin America. So that was my research in 2002 to 2004. Maybe if you do this now, maybe you can get many more subtype because of the very dynamic changes based on the mobility of the people, I think, and the transmission of some subtype also will changes. Yeah. People in Bali still not so aware. Maybe they know that HIV transmitted through needle exchange among the IDUs or by having many sexual partner. Yeah, but that's just the knowledge. Yeah, the behavior. They don't do prevention for themselves. This is the problem for us. Yeah, for prevention. For the IDU, we have needle exchange program and methadone substitution, and this program have a good impact, I think, among the IDU. The prevalence of the IDU having HIV positive is stable now, but among the heterosexual transmission, new cases still increase. The condom use is still very low among the people who visit commercial sex worker. Yeah, they don't want to use condom. Even they know that maybe they can contract HIV from their behavior. So this will inhibit the prevention of HIV in Bali. If we saw the data of HIV positive people or AIDS patient in the hospital, I think most of them are heterosexual, but about 70% of the cases, about 30% is IDU, yeah, and about 10 to 15% is MSM. And now we identify increasing number of pregnant women who also HIV positive. We plan to do the what we call PITC. So we will offer HIV tests to every pregnant woman, because we know that the impact or the benefit of the antiretroviral is very good. Yeah, this is on PMTCT. ARV shows a significant benefit. Yeah, they can stop the AIDS, not transmit to the babies. Yeah, just stop in the mothers. We have motto: you can stop AIDS, just stop at yourself if you are already infected. To prevent babies and children from getting HIV from the mothers is a very good program. I think if we do offer every pregnant woman to have an anti-HIV test, and then we can treat them directly if they are positive.